moment there is a confusion about the quarantine in practice in our country among some people. It should be clarified. Earlier, all the people who are first contacts of a COVID-19 patient were admitted to a quarantine center and were monitored for 2 weeks at that place. But now this has changed, that the people are quarantining at their own residences, and previously at the beginning of the quarantining, some people were undergone PCR testing depending on their risk of exposure, and towards the end of the quarantine period, all the people's PCR has been done and we have identified whether they are infected or not. Only if they are not infected that they were released to homes to be followed with self-quarantining for another 2 weeks. But now all the people are quarantining at their home, and if a person is unable to quarantine at their home because of the social conditions or medical conditions, then they will be quarantined at an institution.
Chief Epidemiologist Dr. Sudath Samaraweera also insists that the testing policy in relation to COVID-19 has not changed.
The testing policy has not been changed. At the beginning of the quarantine, if the person is at a higher risk of exposure, they will be subjected to the PCR testing. If they are negative, they will be continuing the quarantine for 2 weeks. Towards the end of the 2 weeks, we will be doing another PCR testing to identify, to detect whether these people are infected or not. If they are infected, they will be admitted to a hospital or intermediate treatment center. If they are not infected, then the quarantine period will be completed. Whether they are quarantining at an institution or home, it doesn't matter. Doing a PCR at the end of the 2 weeks, it will be continuing as usual.
Dr. Samaraweera added that the country's COVID-19 treatment policy, however, has changed based on evidence from within the country and across the globe.
The treatment policy has been changed recently. Earlier, before they are discharged, after 2 weeks in hospital, we were doing 2 PCR testing, and then if they are negative only, that they were discharged. But with the global evidence and the medical experiences, as well as in our country experience, that we can see that for the asymptomatic people who are not showing any disease condition or signs and symptoms, these people need not to undergo PCR testing. If they continue to be without symptoms for 2 weeks, that means at the end of the 2 weeks, these people will not infect other people. So because of that, doing a PCR test or 2 tests is useless. So because of that, the government has taken a decision to discharge all the asymptomatic patients after 2 weeks if their symptoms free throughout the period without doing a PCR. But after they are discharging, they have to be self-quarantined at their own residence for another 2 weeks. This ensures that they will not transmit the disease to other people.
He also touched on the cricket tournament, the Lankan Premier League, which received the all-clear from the government, stressing that measures are put in place to ensure that those arriving from abroad do not mix with the local communities.
And also that the government has given clearance to continue the Premier League cricket tournaments here, and that it is doing in a way that the players and the other people who are coming abroad will be quarantined here for a limited period, but with a secure manner, that they will not transmit the disease to our community. So that what you call it biosecure bubble, that is people that coming together will be staying together until that they complete the tournament, and during that period from time to time PCR testing will be done, and also we will take the maximum precautions that they will not mix in with the other people in the community, so that risk of spreading the disease from these people if they are infected is prevented maximally. And also the people has to watch the matches from their own home. They are not allowed to come to the stadiums.
ලීව ආයුෂ් කරාබු නැටි දන්තාලේපය ශක්තිමත්